Thank you all for joining us today. This is our Johns Hopkins Medicine Wiki Virtual Toolkit series. And today we are here to engage and amplify our voices for the youth and adolescents.
Hi, everyone. I am Marina Terraforte. I am hijacking the Toolkit series today. Allison is on, but we really wanted to continue the conversation that we started last month with Allison about doing a comprehensive sexual health history. But today I will allow JaToya, Naomi, and Jasmine to continue that. Before we get started, as usual, we like to introduce our program. So we are the Johns Hopkins Medicine collaboration with Wiki for HIV excellence across Central Maryland. And we represent 6 distinguished programs, just really dedicated to providing comprehensive, family-centered medical and support services to women, infants, children, and youth, not just in Baltimore City, but around the region. And as you can see here, we are represented by 6 amazing programs focused on youth, pediatric programs, women's health programs. We have a gender clinic and really highlight psych services as well. So our vision as the JHM Wiki program is to really just create a more coordinated response to HIV care by establishing these mutually beneficial relationships. And as you can see by the list of programs that we partner with, we really are trying to create these mutually beneficial relationships that just highlight all of our programs and what we're doing well. Our mission here is to build upon those existing structures. So to take what everyone is already doing at their programs that work and enhance that and share that across our Wiki providers, but really all HIV providers and multidisciplinary systems of care. But the goal of this toolkit series is to engage and amplify experts. And today we have a number of experts that we want to engage and amplify. So if Toya, you can go to the next slide. As you see here, we are focusing on the importance of sexual history taking, and we're empowering the voices and improving health of youth 13 to 26. And you see our moderators here, Jasmine Pope, JaToya McCrae, Naomi Nina, and I will let them take it away and introduce themselves.
So much, Marina, for a great introduction. My name is JaToya McCrae. I am the Regional Outreach Coordinator for our Ryan White Part D program here at Johns Hopkins, and I will go ahead and turn it over to Jasmine.
Hi, everyone. I'm really happy to be here today. My name is Jasmine Pope. I'm the Director of Programs and Strategic Partnerships and the Director of Star Trek Adolescent Health Program at the University of Maryland, Baltimore.
Hi, everyone. Sorry. Hi, I'm Naomi Nina. I am the Community Outreach Specialist. I work mostly with the Voices Project at Johns Hopkins University, and just recently joined the team with Ryan White Part D, and I'm excited about that.
I signed up for this.
Naomi looks like one of the people from the show.
So I would like to thank you all for joining us today. Today, we are talking about the importance of sexual history taking with our youth and adolescents, and just a brief history of how we have gotten here. Last month, our great director, Allison Agu, she gave a great previous toolkit discussion on tip, the who, what, when, how of sexual history taking across the lifespan. But in this particular toolkit series, we're focusing on adolescents. And we want to understand, last month she talked about the incidence and prevalence of STIs and HIV in Baltimore City and other counties. And we wanted to focus more on the importance of sexual history taking, how did we get here, and what that was like for the youth and adolescents in our communities. So in this toolkit, we're empowering the voices of the youth. And we went and we conducted a survey of 21 youth, and we asked them about their experience with getting their sexual history taken so that we could provide more information to providers to give them information on how they could enhance and improve the sexual history taking process to decrease the amount of STIs that are presenting in our community from the data that was presented previously. From the survey, we were able to conduct a focus group, which we spoke with a small group of individuals who completed that survey and gave us more information on how we can, and gave us some data on what we can do to improve health and what that process feels like for them when they're actually getting their sexual history taken. Go to the next slide. And so we do have some other experts in the room. They actually conduct some sexual history taking. And so I just want to give them a second to introduce themselves.
Hi, everyone. My name is Jenna Dillon. I'm one of the nurse case managers here at the Harriet Lane Clinic, along with Megan.
Hi, everyone. I'm also a nurse case manager here as well.
So much. All right. Next slide.
All right, so we had a really great conversation. I think my co-moderators would agree with the young folks that we talked to. They were very forthcoming and open and sharing, what their real experiences were, and their conversation as well as the surveys had some overarching themes. And so in this slide, you can see what some of those themes were. But I'm sure for each of us, there are some that will jump out. Judgment from doctors, representation and inclusivity, peer influence, and early, and comprehensive education. So from these, there was some alignment with some of the topics that came up in Allison's talk during the last session. Talks about providers incorporating sexual history taking into patient visits across all age groups. Having earlier conversations was something that youth identified. Improving comfort level and skill so that it's a comfortable conversation and not awkward. Young people pick up on that. That was demonstrated in the way they communicated that in the surveys. Offering testing routinely without assumptions. These are things that we hear all the time, but obviously are not consistently in practice in some spaces because they came up again when we asked young folks what their thoughts were around that. And so I just think also, if there are any thoughts about some of these themes, if there's anything that jumps out at you, please put it in the chat. We would love this to be a roundtable discussion where we can have conversation and talk about some of the information that we found out through the surveys and through the conversations that we had with young people to kind of be able to share, collectively how the work that we're doing is impacting the folks that we're working with. We can go to the next slide. So, getting the scoop straight from the source. What does sexual health mean to you? We had to norm on that question because I think that sexual health is a very broad and umbrella topic that can include a host of things. We as practitioners may have our own understanding about what sexual health is, and it means something totally different to young people. It also means something totally different among practitioners. So for the purpose of this conversation with young folks, we wanted to set what their understanding is and what we would all be universally thinking about as sexual health. What does it mean to you?
For me, sexual health is not only ensuring that your physical well-being is where it needs to be, like not just talking about maybe menstrual health or sex, but also talking about from a psychological perspective, like maybe ensuring that relationships are also safe, and just talking about those two different things. So not only just the act of sex, but also the things that go into play, like relationships and those kinds of things. So that's what I think of.
And that is straight from the source.
Yes, that was straight from the source.
And then once we had that conversation about what sexual health means to adolescents and youth, that follow-up question about how important it is to discuss your sexual health with your doctor came about, right? And what we found is that many of the youth and adolescent feel that it's very important to actually discuss this with your doctor. So we can go to the slide to show that survey. And as you can see, 71% agrees that 77% agrees that it is extremely important to have these conversations with their with their providers. And we got some comments and we had some discussion about that. So we can go to the next slide in regards to that. As you can see, some said yes, because any problems and changes in your sexual health can impact your overall health, especially if issues are left untreated. Another one said yes, because although it may be embarrassing and uncomfortable talking to a stranger, I know they have the answers that I seek and trust their medical advice and the ability to do something about it for treatment ASAP if necessary. So these were some of the themes that they discussed about coming into the office, even though they're uncomfortable, even though it may be awkward, even if it may still have that stigma in regards to discussing these topics, they feel like it's important to advocate for their health and they're really open to discussing this with their providers. So now we're trying to figure out what's the barrier, right? Because the youth is saying, I want to talk about it. So
One of the questions we asked was they may want to talk about it, but what is their comfort level, right? And so when we went in and we used the data from the actual survey, it reported that about 59% of them felt comfortable speaking with their doctors. And it's a little over half, but we want to make sure it's a lot more than that, right? And so just with that information, we know that creating a safe environment would be best for the youth in expressing what it is, in expressing those answers to the questions that providers are asking. Jenna or Megan, have any of the patients that you have had talks with in reference to their sexual health, have they spoke about their comfortability level when you've conducted those assessments?
Yeah, I think that's one of the things that we really try to emphasize is making sure that the patient is comfortable. And I think a lot of that comes with getting an understanding from the start of their visit about what their goals are, and what it is that they want to talk about, but also for us to be the ones to bring it up. Because especially for youth, it can be uncomfortable to be the one to be like, hey, I want to talk about my sexual health, or I had this happen. So we try to make sure that we like establish a relationship and create trust and talk about other things first and get a sense of their goals. But then if they haven't brought it up, we do try to make sure that we bring it up so that they can know this is a safe space. You can talk about whatever it is that you need to talk about. No question is like a weird question or a stupid question. You're asking great questions, and we try to help facilitate it that way by making them feel comfortable.
Yeah, I think another important part of that is giving adolescents who come with their parents dedicated time just with the providers. Because not only is sexual health something that they might be uncomfortable talking about with us off the bat, but then to have their mom in the room is something that I think in most cases they are going to be uncomfortable with. So I think in my experience, they get a little more comfortable when the parent leaves the room, and we just make sure to let them know that this is like a protected space. Anything you talk about, unless it's something that's going to cause harm to you or someone else, is protected from us sharing with your parent or guardian. And I think that does kind of make them a little bit more comfortable to open up to us too.
And I think another thing that we do too is say like, hey, we ask these questions to everyone. This isn't just you that we're asking these questions. And then we have in our assessment, like very detailed lists of questions, but we ask them, we kind of tailor them based on how the conversation is flowing and based on what the patient's need is too. We try to like tease that out through those questions. Yeah.
we love that. Oh, Toya, we can't hear you. There we go.
Can you hear me now?
Yes.
Okay. All right. Thank you so much for that, Naomi. I like how you said that you kind of go with the flow of the conversation in your questions. So like jump into something that's like, okay, we weren't just talking about
I
that.
agree. Yeah, I love that. And it also flows into the next question that we even have. Like you brought up good like points in regards to establishing that relationship, right? Rather than just being provider to patient, it's creating that relationship and humanizing that interaction that makes them comfortable to actually talk with you. It creates that boundary of like, even though you're my patient, I still see you as a person, a young person, right? And I want to respect your autonomy while also providing information for you, right? Because I care. So I love that you both highlighted that, like caring about what their needs and their goals are, and then jumping into that sexual history taken.
Yeah.
I love to like I've seen this a lot from Dr. Agu too, starting these conversations when people are young and starting like how you mentioned, getting the parents out of the room at a younger age and the patients know that they have this like private time to talk about things with their provider. And we start that pretty young so that, and then the questions just change over time and evolve. Yeah.
71% reported that doctors do take the time to ask about their sexual health concerns during their visits. And some did report that their doctors only ask like a brief question. So let's see what some of the other responses were. We have a video here. Let me go ahead and play that.
When I was up here, my primary care doctor, he asked me, and I was like, I'm not doing nothing right now. So like it was like, yeah.
Was it uncomfortable?
No, it
Okay.
wasn't uncomfortable. It was just like
What she was stating was that her doctor made her feel a little uncomfortable because they started asking about her sexual history, but she was stating that she hadn't done anything yet. She hadn't had a sexual history, so she kind of felt like she didn't know where those questions were coming from. And so, like you all were saying previously, like getting that interaction with the patient before asking questions that probably wouldn't even pertain to them would create that comfortable environment. So I'm glad that you all do that with the patients.
Yeah, and it also goes back to what Jasmine stated in regards to what sexual health is. So sexual health isn't only are you having sex, what type of sex are you having? It's about those relationships, right? The environment that you're in is about asking additional questions that are just not the act of sex.
And I think too, if somebody isn't having sex now, or you can kind of tell that they're not comfortable or not ready to talk about it, we try to let them know that we are here. We have resources. They can reach out when they do want to talk. So just like letting them know that we're here for future discussions or whenever they do have questions.
I think it also speaks to what Dr. Agua was referencing about improving comfort level, because a lot of times, even in talking about sex with patients, like what is sex, right? Like, or are these conversations about like safety and activity and like how we approach it, and knowing patients and knowing, you know, what their goals are. And maybe you don't know right on the first time that you meet a patient, but examining them as a whole person, not, okay, first I'm gonna talk about you and sex, and I want to talk about you and asthma, and then I want to talk about, you know, like you're a whole person and how you exist in that way.
Exactly. Love that.
Anonymous youth on the call. I want to know if she wanted to go ahead and unmute herself to introduce herself to the conversation. That's all right. We'll come back to you in a moment. I do want to play this soundbite from another youth.
Definitely no. I feel like like when I walk into my doctor's office now, given like I do my sexual health through the primary care physician's office, so maybe an OB's office might have a little bit more like pamphlets and informational stuff as it pertains to sexual health. But I see a lot of pamphlets for like, you know, diabetes medication or hypertension and things like that. But when it comes to sexual health, it seems
All right. She was pretty much stating that there isn't much information in the clinic that even discusses uh, sexual history taken or any information in reference to their sexual health outside of other health conditions that they find to be of importance. Um, Megan and Jenna, uh, down in the clinic, are there any documentation or information that is available for the youth to take as resources that discuss sexual health?
I feel like not as much, honestly, as we would probably like to see. And I think this is something that's ongoing. We're having conversations about how to make like our lobbies and our spaces more youth friendly. But right now, I really don't think there's a ton of information like sitting around for patients to get. And that's something that we do have kind of ongoing conversations about. We'll try to discuss like and show them in the visit websites, reputable websites to check out for sexual health stuff and LGBTQIA friendly sites and that sort of thing. But I think that person is right. There's really not, at our clinic, I don't think there's enough stuff like sitting around for them to look at while they're waiting. And sometimes you do have a long wait to see the next provider, to wait for the lab, and it would be good if we had like QR codes or pamphlets, stuff like that for people to access, because we really don't.
Yeah, I agree that there is a lack of just available information lying around. And like Megan said, I think we have a lot of information and resources that we can share with patients. And one thing that comes to my mind with that is we do a lot of STI treatment here. So then I think we do a good job about talking to patients about their partners and getting their partners treated. But I think it's more, giving them resources, telling them they can go to the health department, telling them about I Want the Kit and things like that exist. But if we didn't, in a different clinic, if a patient were getting STI treatment and nothing were brought up about their partners, I think if that information isn't readily available, that might be something that doesn't even cross their mind or that people aren't comfortable talking about.
Yeah, definitely something we have a lot of room for improvement for here.
It's Allison here. I think it got me thinking, even when in places where we have information, a lot of times it's focused around this is what the STIs are or things like that. And going back to the adolescent's description of sexual health, I mean, we should be talking about healthy relationships. And there's so many other things that go around sexual health, including, I think we're almost afraid to tell kids that sex should be is a normal part of development in life and it shouldn't be painful and things like that. And I think we don't do enough about sort of how do we normalize what is normal about sex and give people places where they could actually find out more information that helps them to understand what's a good sexual health and history versus not. And so I just think would love to think more with you guys about how we do that. We should all be thinking about how to best provide that.
I have a good list together because I wasn't sure if we were going to talk about this, but I have a good list together of some websites too that we use or have used. These all came from the Trevor Project, has a good like sexual health resources for youth. So yeah, for Caitlin's question, I'm wondering if there are other delivery modalities that others have had success with. And Caitlin is kind of our like lobby champion for making this more youth friendly. So yeah, I would be curious, like Jasmine at Star Trek, do you guys have anything in your clinic that you do that the youth have been excited about? Because you guys do so much cool stuff for the youth.
Yeah, in our sexual health suite, we don't have a lot of messaging around like wear a condom or make sure you're talking about STIs. It's like Beyonce posters and like resistance leaders and things that are just like they are not just about sex, right? Like it's a space where people can come, feel comfortable. You can, there's comfortable seating. We have candy. I know it's a clinic, but everybody needs sweet sometimes. And yes, there's condoms, and yes, there are pamphlets about testing. There are, we use a lot of information from Advocates for Youth. They have great, like lots of great materials, social media things. But like that's sort of how the establishing like comfortability, reflecting, like walking into a space and seeing yourself and having a feeling of belonging, like that is what it should feel like. That is where the trust comes from, because the first interaction are the front doors, and then the lobby, and then the front desk, and then you get to the back. And sometimes the opinion and experience has already happened, and by the time they get to the sexual history part, yeah, I'm not telling you anything. That's crazy. So, you know, like I think that is really the center of it, is understanding who you're serving, and then have your services reflect that person, because nobody is just how they have sex. That's just not real.
Right.
Even though it's what we think about first, well, not first, but like it is a priority as a deliverable for the work that we do, but we are treating people, humans. So that's kind of the approach that we've used.
I like that a lot.
Same.
I would like to chime in.
Oh, I'm sorry.
Iris.
Yes, this is Iris. Yes, yes, yes. I just want to chime in a bit. We do touch on healthy relationships. We always do it around February. So we do talk about what a healthy relationship is, domestic violence, and we provide resources only during our youth advisory board meetings. So that's something that we kind of talk about. We should talk about it a lot more. We also talk about safe sex prevention and have different workshops around that. But one of the things that we always have to keep talking about is what is a healthy relationship, because when they're young and they're in relationships, sometimes those relationships are very toxic. And, you know, they come and tell me everything because we built that rapport. So, you know, that's something that's just kind of like an ongoing battle when you're just dealing with youth in general, but that's something that we always do touch on. I don't want to think that we are not actually reaching some of our patients, but we are reaching them through the Youth Advisory Board, and we do talk about healthy relationships always around Valentine's Day.
So thank you. That is our youth advisory board leader. So thank you for coming on and jumping in and stating that. And she made a great point about creating that comfortable environment and having the youth being able to come in and speak to you. And so one of our next questions is, do you worry that your doctor might judge you based on the answers to any of those sexual health questions that are asked during the assessment? And here is some of the responses that we have received. Naomi, did you want to speak about that?
Yes. So some of the things that we got was, I don't have any worries because it's nothing my doctor can tell me, tell my parents that I haven't already told them. And then some said, don't do something you're not comfortable with, right? So once again, that conversation, and also even in that comment, a little of that stigma, don't do something you're not comfortable with, right? So these are some of the things that we surveyed from the youth when we asked this question. And is there a video?
Yeah, that when my aunt used to take me to the hospital, I be like feeling nervous a little bit because I be wondering what they be like saying and stuff to her.
So that no, it's fine. Go right ahead.
No, so some of the things that they also said is that they have this worry about this information being given to other parties, and that's why they don't really state anything. And once again, that's the information that they're receiving about the healthcare system, right? This is information that they're getting from the community. This is also information that they're getting from their peers that have experienced this, right? So even that, like, back to what everyone was saying about building that rapport and building that trust, even within the community, right? Outside of the clinic, outside of just being a provider to patient, how do we develop these relationships with the youth to help them understand, like, hey, the information that we're receiving is just to provide better care for you, for adequate care for you, and knowing how you can advocate for yourself as well. I think that goes into like humanizing our services, and back to what Jasmine said, seeing that patient as a whole and actually identifying the psychology behind why they may not want to share sexual health information, because of that fear. Is it going to get sent to someone else? Especially to third-party companies, right? This is a generation where information is on Google. They can Google things that are happening. So how do we break down those barriers in order to create that trust?
Yeah, I think, oh, sorry, I didn't know.
No, yeah, go ahead.
Well, this is going right into it. I think we, like Jenna was saying, when we get the parents out of the room, the first thing we do is tell the patient, anything you share in here with us is confidential. The only time we would ever need to break confidentiality is if there were any concerns that you, for harm for yourself. And so we try to make that clear up front. And then with the Maryland's minor consent law for reproductive health services, we don't have to share anything, and they can consent for their own reproductive health services too. And yeah, so we try to start out that conversation by letting them know this is a confidential, safe space.
These are just some of the responses from the survey that we put out. They said, I don't have any worries about my sexual health. They even brought up HIPAA. They say, I understand it would be a violation of HIPAA to have my information spread. So let's move on to the next question. I love that we're keeping this conversation going.
Can I add one thing to that, Toya? I did want to say that I think that like those fears are also grounded in historical harm. And like one, I don't think we can pretend that it's like, oh, I don't know why you don't trust me. I think we know. But also one, the developmental stage of adolescence where there's just like very little control. There's lots of authorities in your life. And when out of the gate, we're not saying like what your rights are. So like hearing you all say that like the first thing we do is say, here are what your rights are. Your information is private. There's like a real law on the books that says your information is private. But also when we're signing those millions of sheets in the beginning of the appointment, that's like, do you want me to send this to someone? Do you want me to sell to the person I send this to? They can send it to someone else. Like, I think we have those stock things, but figuring out ways to communicate on a level that everyone gets an understanding about what information sharing is in a medical setting for young people is probably very helpful. I thought about that when you all were talking, like we know that we have these things, but we're all communicating it in different ways. So some young people know that they have a right to certain things, and other people think that they can't seek care because they don't have the ability to navigate it on their own.
I think that's a good point, especially with things like my chart too. That's a real concern for information getting into your parents' hands that you didn't like testing. And so making sure that that's all like safeguarded so that it's not getting to the parent too. That's a really good point.
I could take this next slide. Oh, so the importance of creating a safe space. We talked a lot about, you can go to the next slide. Oh, is that a video?
So, like you said earlier, that's my safe space. You know what I'm saying? So I feel like we should definitely have a good relationship, but definitely a good bond, because like when situations happen, instead of me going to Google, I can just, reach out to you or talk to you about it and get a better understanding and, get a better clarification of it. I feel like I do what my provider does, because like she know like my anxiety is like real off the wall. So it's like when I be feeling something on my body, I like go crazy, like, oh, is it my HIV? Is it this? And she be like, just take a deep breath. It's gonna be so many other things in there. And I be like, I know, but it's like me still learning, and I know I be on and off my medicine. I know hey, it's like up and down for medicine. So I be like still, trying to learn how to, deal with it. So she be like, well, your main stressor is that if you take your medicine, you know you're gonna be all right. So if you're not taking your medicine, that's where your anxiety come in. So I was like, all right, that makes sense.
So communication, right? And we have a young person who's on the call right now, who's on the meeting, that I would love if you have more to say to how important communication is and how communicating. Like you said, if I could just get in contact with you and I don't have to jump on Google, which means that your provider has to be in some way, they have to be communicating with you, like they're responding to your MyChart messages, they're doing these things, or you can speak with the nurse, like your office is available. How important is that?
Okay.
I don't know if she's still on.
Hi, Raven. Are you able to hear us?
Well, she wants to repeat
Oh,
the question.
oh, absolutely. So I was saying that, one of the things that was mentioned was being able to communicate with your doctor, not just like, yes, you're understanding what I'm saying, I feel comfortable communicating, but also I can reach you if I, in a reasonable way, if I need to find out information, or I need to know something in order to make a decision about my health. How is that? How important is that?
It's very, like I said last time, it's very important to me because like I deal with a lot and I like tend to go from 0 to 100. So, and I'm a big stressor. So it's like, if I feel like, I can communicate with my doctor or my support system and, lessen my stressor, that's cool. And I feel like it's very important because if I'm on 100, things can happen, so I can go wild out and my anxiety be like taking over. So it's like, I feel like it's very important to communicate with them and have the communication coming back.
Thank you. And I'm also curious to know, is it because how we communicate, right? That now with technology, there's MyChart, there's, if you're certain practices, you can text message, you're the nurse, or what have been the best ways and most comfortable ways communicating with your healthcare provider?
For me, in the beginning, it was always MyChart, but now as I got older, I feel like in person is better. But it was always MyChart. It still is, but to me, I feel like now is in person is better.
And was that experience consistent? Like, did you have consistency with like responses and feeling good? Like, okay, I know I can just reach out and they'll respond and it's cool.
Yeah, when I first started using MyChart, like everyone else was like, it was difficult for them. Like for me, it was easy. Like I got into it, I was able to like, learn how to work it and stuff. And then like when you send a message, like it do say like 3 days to respond, but it don't take that long. Like, and I'd be like, all right. And it's better for me because like when I be like noticing stuff that's going on with me, I straight go to Google. So I'd be like, no, forget that. Let me go to MyChart where my provider's at. So yeah.
All right. Thank you. Thank you. So some of the other comments, just around confidentiality. Yes, my doctor is thorough. Is this the same question? I'm sorry. Did I go back? Oh, communicating with my doctor. Yes, and then someone said that my doctor is fast and tries to get the job done quickly. It makes me feel rushed, which is a very unfortunate thing. My doctor thoroughly explains herself and her thought process. I think that is important because a barrage of questions without any sort of context does not work. It doesn't work for grown-ups.
Our next question here was, does your doctor's cultural
Hello? No, I don't hear you, JaToya. JaToya, I don't hear you. Uh-oh.
Am I back?
Yes.
Yeah, I'm sorry. Did I cut you off, Jasmine?
It's all right. It's fine. I was just saying that one of the young folks highlighted that the thought process of the provider, that, they were thorough and shared their thought process behind the questioning, and that given context is so important when we're asking all of these questions, because none of us like to just be asked things without giving context about what it's leading up to or the purpose of it. So I thought that was really insightful that the young person highlighted that the thought process was important for them in thinking about how the communication was happening.
Can't hear you, Toya.
I don't know what's going on with audio. I was
Hear
just
you now.
asking. Okay, I was just asking if you wanted to take the cultural question here.
So we also asked the question of, does your doctor's cultural or ethnic background influence how comfortable you feel discussing your sexual history with them? And we could go to the next slide to show. And they said no. A lot of them were saying no. They never really thought about it. To them, it was more about safety and how they can feel comfortable and their experiences, right? Their education. As long as they have their education experience around sexual history taken, that they felt comfortable, and it didn't matter in regards to their cultural background or ethnicity. Some of them said their cultural or ethnic background does not make a difference, but some said maybe. I tried to choose doctors who I would be comfortable sharing information with. And even that, we can discuss, like, what does that maybe look like? What does it mean trying to choose doctors who I feel comfortable sharing information with? And that goes back into types of relationships, types, seeing people as whole, right? Does that mean I will probably feel more comfortable as a queer person with an LGBTQ plus provider, right, who centers or has a focus on that? Do we, or even if we're not specializing that, do we have that information in the clinic to make me feel comfortable? So you may not identify as a queer person, but do you have information in the clinic that makes me feel seen and represented and visible, right? So those are the types of barriers that we speak of in regards to, does the cultural factor, ethnic factor make a difference in the level of care that is provided to a patient?
All right, A says, nope, does not matter. I will share anything with any provider I have. Doesn't matter their ethnicity. All right, I hear you, A. You said I'm paying for this appointment. Don't matter for me. All right, Z says, nope, doesn't matter. Faith says, no.
Toya? Can't hear you.
All right, can you hear me now? We were trying to get together. Better?
Yes.
Okay. Thank you, Marina. All right. So our next question is, are you comfortable discussing your sexual history with your doctor if they are of a different gender? And let's move right on into those responses. There is the audio here. I'm gonna let that play.
So, like you said earlier, that's my safe space. You know what I'm saying? So I feel like we should definitely have a good relationship, but definitely a good bond, because like when situations happen, instead of me going to Google, I can just, reach out to you or talk to you about it and get a better understanding and, get a better clarification of it. So,
All right, so that was a repeat of a previous audio, but the answer to that question was not always. I have had a very dismissive experience with doctors of a different gender. I prefer all of my doctors to be of the same gender. I'm not sure what gender that patient was, but they prefer same sex gender. No, because my doctor is a female, and I wouldn't be comfortable sharing my thoughts with the opposite gender as me, which is a man. Here, no, because I just want to be transparent regardless of the sex of my doctor. So I think it's important that we understand who we are talking to when you're getting a sexual history taken from the youth. They may not feel comfortable or even want to open up to you because your gender is not the same as them. Whereas some others may feel differently. They can speak freely with any gender provider. Are any providers on the call that have experienced that? And what have you done to provide that patient with a level of comfort in providing you with the sexual health information that you've needed during the assessment?
I don't think that we have really experienced this a lot here. We're fortunate, I think, in that we have 2 male and a few female providers, so that I think it's usually like apparent right off the bat if it's not going to be a good fit, and we switch them pretty early on. And even that doesn't happen pretty often. But I think, yeah, we definitely ask before starting that relationship. But I don't think, from my recognition, from my remembrance, that we have had this issue.
Yeah. I think too, for our providers and as nurses or anyone on our team, if somebody expresses that they would feel more comfortable with someone of a different gender or a different cultural identity or ethnic background, we aren't offended by that and are try to point them in the direction to get them the resources that the person that they will feel more comfortable with, no matter what that is, so that they don't feel like trapped in something that they're not okay with.
I think
Thank you.
I think this also may be a good space to uplift the experience of trans folks and our our adolescents who are gender expansive or identify as transgender. Often we may not have providers who like are even, I don't know how we are even considering it in the question, right? Like, particularly when we look at the rates of STIs and, you know, healthcare disparities that are from sexually transmitted diseases, they are mainly disproportionately affecting folks who are LGBTQ plus. And so I think identifying that there aren't a lot of providers who are reflective of that population, and how do we address that and create safety and create comfortability and create belonging in our spaces, so that folks do feel safe if, you know, we cannot provide what they're asking for in terms of providers.
Yeah, that's a good point too.
That is a great point. I have heard of providers needing more training on understanding the different genders that they have to interact with, and even having the education on the pronouns, how to approach people and what they want to be called. And so just providing resources to providers to say, hey, you know, it's okay if you don't understand, but to have the resources to be able to properly assess those clients and make them feel comfortable in the spaces that they are providing the information. So I think that's very
Yeah, absolutely. Absolutely. And even beyond pronouns, how are we asking questions? Like, how do providers understand how to talk about body parts, how to talk about sexual activity? You know, there are, I'm sorry, like there are best practices for that, right? Like there are trainings and resources. And I think there is a accountability to folks that if you are providing sexual health, that you are skilled to do it with everyone who is in the community, you know, that are coming through your doors, because this is where we are not able to get folks who need care to come in and feel comfortable and make it routine and not go to the ER and not have this anticipated like trauma from coming into an office.
Right. I agree. I love that you said like take accountability, right? Like if you're providing doing sexual history taken, having that accountability to learn more outside of the heteronormative, right, scope. And I think that's what I love about Harriet Lane Clinic as well, is that we have all these additional resources, especially like with the Voices Project, right? That's where we come in to provide that additional services in regards to censoring LGBTQ plus patients and clients. And I think if like more providers would like encompass that and within their clinics, I think these barriers that we're speaking about today will just be alleviated, right? One step at a time. It doesn't have to happen in one grand scheme, but just that accountability. Like I love that you said that accountability, because it's so important.
absolutely. All right. Next slide.
Of
I
course.
think it would also be important for physicians to start talking about sex early. and not just waiting until like you get your HPV shot when you're 16 plus or whatever. Like maybe start introducing that topic without it feeling like a rushed thing. Like I know some of you guys were saying sometimes they'll just ask, oh, are you having sex? All right, okay, keep it pushing. Let's talk about the next thing going on. Like I think it would be important for them to be competent in that area, because if you start early and like making these safe spaces for people to express themselves, then they'll feel more comfortable in sharing information with you versus withholding stuff and maybe getting like somebody getting involved in something, or maybe putting themselves in danger. All that kind of bad stuff could have just been stopped had they just like had a safe space for their patients, especially.
All right. And that was one of our youth participants expressing what she felt providers should present to them when conducting a sexual history taken. Does anyone have any feedback in response to what she has said?
I think Megan said earlier that we start giving patients alone time, I think starting around like 12. And those questions are kind of tailored and changed throughout time as they get older. But I feel like I've heard providers do a really good job at starting off at, and I think calling it age appropriate isn't fair either, because what's age appropriate for one person is going to be something completely different than one of their peers. But I think starting off, I've heard providers say, like, is there anyone at school that you have a crush on? Or are you starting to think that you might be liking boys or liking girls? And that I think also opens up the space for them, instead of just asking like a young girl, like, oh, are there any boys at school that you like? And that kind of closes off the conversation then as to like, you know, that's all that you can really talk to me about. So I think, yeah, I've seen a good job be done with starting the conversation early, and as, again, I hate to say age appropriate, but starting with more elementary topics, and then as we learn more, kind of escalating it into what's appropriate for that patient.
And also using that time with young ones to talk about like boundaries and body safety and healthy relationships, like Iris was mentioning too, like that, starting those conversations early, even from friendships and like healthy friendships and family relationships. And that's all a part of that conversation as well. So, yeah.
During our focus group, Jasmine, you had asked a question. You asked in the chat, you said that put the ages in the chat. I can't remember exactly what the data was, but you asked, like, what age should providers start asking about sexual history or the appropriateness, or just getting down to the nitty-gritty of what it is that providers are needing to know from patients, or like what they're experiencing or what they're going through. Did you want to touch on what we discussed in the focus group in reference to that?
Yeah, so I don't have unfortunately the ages in front of me, but they were lower. They were some folks said 12. I'm trying to think. I don't know if you all remember it. There was younger than 12 though. Yep, thank you. Between 10 to 12. And I think that was one, everybody said that they felt comfortable. We also asked if you were the person who is talking to you about your sexual health, have they been your provider since like you were just a wee one? Like, did you come up with that person? And what was the transition like? You know, we're like, all right, mom's gonna leave the room. Now we're talking about big kid stuff. And some folks had been with their provider for a long time. Some folks had new providers. For the most part, had comfortability, but still wanted the conversation to happen sooner. So they didn't bring it up with their doctor, even though they wanted to have information, because they said, yeah, I talked to my friends about it. And honestly, that's not really a reliable source. So I think that there are missed opportunities there. And another question that I had to all of the providers who are on the line is, as we're talking about this, what is, in the next 5 minutes, family and parents, right? Like, is that a barrier to earlier initiation, to asking folks to leave the room, to how do we navigate that, right? Like, how do we have all this great information? We know what kids want. Cool. How do we navigate the caregivers and parents?
I know at Harriet Lane, it's posted right out front. I think it's 11 or 12. At that age, it's made clear to the parent that their kid is going to get this time with the provider. It's not even like a question for the parent, really. So that helps it not be like a struggle within the visit. They already know going into it that that's going to happen. But then I do wish we had more time after to like also, or like focus groups or time with parents to offer them sexual health classes or curriculum as well for them to come without their kids and like, these are the questions that your kids might, in a broad general sense, not just your kids specifically where you're breaching confidentiality, but I do wish we had more opportunities to provide that information to parents too and help them navigate those conversations with their kids too, because it is helpful when you have like a trusted adult you can go to. So yeah, I do wish we had more time with parents to do some of that education to help them formulate those relationships with their kids.
Yeah, more waiting room literature. You can add that to the list.
Yeah.
I think the response is usually one of two responses. One is parents either have a hard time, like, what do you mean you're taking my 11-year-old by themselves to talk about sex? And it just feels so scary to them. But I think a lot of parents are also kind of relieved, like there are probably things that my teenager is doing or has questions about that they're not comfortable asking me about. So I'm glad that they have this space with a trusted adult to have that conversation. But I agree, it would probably be helpful for parents to know exactly what that looks like a little bit more.
I want to jump in really quick on this one, only because I have an 8-year-old myself, and you know, he's 8, but like, I think conversations need to start a little earlier within the home. Of course, we probably can't do that in a clinic setting for an 8-year-old in the room and, have those conversations. But maybe providing some sort of statistics on, what age does, children start actually having, sex or being, having sexual encounters, and having pamphlets that we actually can give to those parents, just to say, hey, did you know? You know what I mean? So that they could be prepared to ask those questions early on before we get to the stage where we're in the clinic setting and we're pulling those 11-year-olds in the back, trying to getting them pre-engaged before that actually happens. So it's an easier transition to actually be able to have those clients, patients come inside the room at that early age.
Yeah, I love that. I agree.
Yeah, I want to jump into, I have a 16-year-old daughter and a 14-year-old son. And, we all know the differences in communication styles. Sometimes girls are just better able to express themselves. My kid's pediatrician has been their pediatrician since they were born. And she started the conversations earlier with my daughter. She started asking me to leave the room when she was 12. And they would talk, and my daughter feels very comfortable now having those conversations with her. But she didn't start having those same conversations with my son until he was just turning 14. And he's a lot more confused now, where right after that initial visit, he's just like, why does she want to know this? And like, why does she want you to leave the room? And like, just more concerned about how am I, like, he doesn't understand patient privacy, confidentiality, but also like, what are you looking for? What do you need to know? So those are definitely some conversations that we've been having lately, but it really highlights the importance of starting the conversations earlier, because now that he's older, he's a little bit more wary of what to share, because they haven't sort of established that level of comfort. And it also does make me wonder why start the conversation younger with girls and wait for, to start that conversation with boys. What is the perceived bias or perceived risk associated with girls that we're not seeing as providers with boys?
Thank you so much for adding to that conversation. It is 1 o'clock and we could talk about this all day. It is an interesting conversation and we all need this, the added benefits of, here we go. Here's some resources right here. If you could take those down, these are just some websites you can go to for more resources for LGBTQ, for LGBTQ resources. There's a free HIV testing kit there. The Violet Project provides resources for young ladies. These are our emails if you have any questions or want to contact us. But I do want to thank you all for joining us on your lunch breaks. And please reach out to us if you have any questions. It has been a pleasure. And we're going to go ahead and end the recording.
Well, before we do that, let me tell you guys, we have an exciting toolkit next month on November 21st. We're having one of our providers in Boston join us. And the topic for that one is chemsex, what the HIV provider should know. There are lots of questions that I already have, and I'm sure you guys do too. So join us next month on November 21st. And as usual, I'll send out the slides and the recording either tomorrow or Monday. So thank you everyone for joining us and joining the conversation.
Hi, thank you.
Thank you to our panelists. You guys did great.
Thanks. Thanks for having us.
Yeah.